Hi, I'm Jacquin. I've made this video to answer a question that's often asked by newly trained hypnotherapists, newly qualified hypnotherapists. And the question is, what happens if when I've hypnotized someone, they open their eyes? Is that the end of the session? What should I do? Does that mean that person can't be hypnotized or that I've messed up in some way? The example I'm going to give you will demonstrate how that has happened to me, how I've overcome it, and how you can overcome it in your own business. Some years ago, I was in Swansea and I was running a group quit smoking hypnosis session. There was 200 people in this hotel conference room which I was working with. And if you can imagine, there was 100 people in a block of seats sort of this side, there was an aisle, and there was 100 people in a block of seats that side. And I'm standing here, I've got a lapel mic on, and we've had the discussion about hypnosis, we've had the discussion about how we're going to overcome this smoking habit for them, and then I've hypnotized the group. Now, if you can imagine, I'm at the front of this room, there's 200 people in this room, all sitting in their chairs, all in a hypnotized state. But as I'm looking down the aisle, all of a sudden, one of the men sit right in the aisle suddenly falls out into the aisle, falls off his chair into the aisle. Now, whether he'd fainted, whether he was so deep in trance, so relaxed, he couldn't feel anything, I still to this day don't know. But obviously, it was a new experience for me. So, forgetting I had a lapel mic on, I went over and I was concerned because I'd never seen anybody in one of my sessions laying on the floor before. So I went over to him and first thing I thought was, he's so deep in trance that he's out of it. So I thought, right, without thinking about everyone else in the room, I just started to say, like, in a moment we'll count from 1 to 3. On 3, your eyes will open, back to normal. So I started to say this: 1, waking up; 2, 3, eyes opening. I've got my assistant to help this man back into his chair, but obviously, because I had a lapel mic on, as I'm counting and saying those words, everyone else in the room is now coming back up out of trance. So now I'm in a situation where I've got 200 people in this room that want to quit smoking. What do? Do I say, sorry everyone, I'm sorry that's happened, please collect your fee on the way out? But no, I thought to myself, I'm here to help these 200 people quit smoking. That's my job. That's what I want for them. So I went back to the front of the room, and not knowing that this would work, I just said, okay, everybody, back into trance. And I swear this is what happened. 200 people went back into trance. Now, did I know that was going to happen when I said those words? No. I had my doubts. But I've studied Milton Erickson. In one of his case studies that are written up somewhere, he was working with someone that was suffering from face cancer. The man was actually dying and he was in chronic pain, and the man's daughter had asked Milton Erickson whether he could help him. So he went along to the hospital and he did some hypnosis with him, and he said these words, and I've used them myself now many times throughout my life in situations where I'm not sure about something. And his words were this: he said, I had my doubts how effective I could be with this man, but what I had no doubt about was I could keep my doubts to myself. So when I stepped up in front of that room of 200 people, I said back into a trance, I had my doubts, but what I had no doubt about was I could keep those doubts to myself. And because I did that, and because I was congruent in what I was saying, and my intention was right, they went back into trance. So as a newly qualified hypnotist, hypnotherapist, there are going to be times in your career where you have your doubts. But if you remember those words, I had my doubts, but what I had no doubt about was I could keep my doubts to myself. That's going to help you in your business. It's going to help you get better results. When I work, I hold this as a core sort of belief of mine. When I step up to hypnotise someone, whether I'm sitting down to hypnotise someone, this is what I think to myself. I think, you're a good subject and I'm a great hypnotist. My intention is you're going to have a change in your life that's going to be positive for you, and you have the ability to do that. So with that core belief, I go into every single hypnotherapy or hypnotic situation, and I believe I get better results. I believe you'd get better results if you hold those core beliefs. When you go step up to hypnotize someone, just think this in your mind. You're a great subject, I'm a great hypnotist. I'm going to hypnotize you and you're going to get a wonderful result from it. Is that 100% true? No, there are going to be times when you don't. But by holding that core belief, you will get better, more consistent results with your clients. So I hope that's helped you. Hope that's helped overcome some of those doubts you may have had.